Our guest on this episode is a senior community health worker who specializes in hospice and palliative care and primarily serves communities on the south side of Chicago. I'm excited for you to learn about the work that she's doing and the impact she's having on the community. You're listening to the PHEC podcast, episode 387. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and government agencies that serve Black, Indigenous, and people of color communities, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always humbled and honored to serve. We help our clients collect, analyze, manage, and communicate their data and health information in plain language to the communities they serve. Now, if your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website, DrCHHuntley.com. We'd be happy to meet with you and explore how we might be able to help support your organization as well. Links to connect with us and our website will be provided in the show notes. I'm excited to introduce you to my guest on this episode. I'd like to formally introduce her to you, and then I'll connect our conversation. Kandis Draw is a senior community education associate and research liaison with the HAP Foundation, which is an organization that provides hospice and palliative care. Kandis works primarily on the south side of Chicago in the Chatham-Inglewood region. She provides free public education for the community about issues pertaining to serious illness, including grief, caregiving, advanced care planning, and disparate access. She is also a community health worker innovator, working to promote leadership of community health worker roles in community engaged research. She was most recently part of the leadership team on a project in partnership with National Opinion Research Center at the University of Chicago that sought to better understand knowledge, attitudes, and behavior around hospice and palliative care of Black individuals living in Chicago. She was recently recognized on the 2022 American Public Health Association's Community Health Worker Section Leader Award, related to her leadership in embedding community health worker roles within research projects. She serves on the Illinois State Commission of Gynecological Cancer and is currently pursuing her master's degree in public service leadership at Loyola University in Chicago. She brings such fire and energy to the conversation. We talk about community health workers, her journey, some of the work that she's done along the advocacy route, and then we dive into a few very timely conversation topics based on the timing of this recording, but I think they'll also be relevant no matter when you're tuning into this episode. So without further ado, let's connect my conversation with Kandis right now. Hi, Kandis. How are you?
Hi, Dr. Huntley. Good morning.
Yeah, it's a morning. We're sitting here chatting about, we're recording this on a Monday morning right after holiday, so we're both moving a little slow, trying to get into the swing of things.
Yes.
Maybe needing that second cup of coffee.
Yeah, but it's good to be here and it's good to talk to you.
Well, I feel the same way. I'm excited that you're here. We didn't get a chance to chat as much when we were both at the conference back in Minneapolis a couple months ago. So I really am excited that we get to have this conversation and get to know each other a little bit more here on the podcast. So thank you for making some time for us.
Absolutely.
Why don't you just tell everyone a little bit about yourself?
So my name is Kandis, and I'm in Chicago. I am a member of the Black Caucus of Health Workers, where Dr. Huntley and I met. I've been a member of the Black Caucus of Health Workers for about 3 years now. I also work in public health I'm a senior community health worker now for the HAP Foundation, which stands for hospice and palliative. So I'm a community health worker that works in end of life, a serious illness for adults and children. And my area of the city is Chatham and Inglewood, with a high Black population. West Inglewood has a high Latinx population. But that's the area that I'm responsible for, and that we do presentations and everything on end of life, on serious illness, on what is hospice, what is palliative, what is grief and loss, what is advanced care planning. We don't do the planning, but we use the 5 Wishes Advanced Directive as what we give out to community members during some of our presentations and our talks. So I'm a community health worker that works in end of life, but I'm not in a hospital.
Yes, I got it. There's so much to unpack there, and I'm going to definitely come back into it because, on a personal note, when I lost my mother last year, and she spent a little bit of time in hospice, so I got to experience that process firsthand with people, which, really, I think that there's a certain type of hero that don't get enough credit. People that work in hospice or choose that specialty area, because that's a great, more of a need, I think, for education, for people to understand just what that process is, how to fully take advantage of services. And then the people that provide that care at that point in life are just special people, because that's a very difficult time for family members, thinking about my perspective, even though I understand intellectually what it means, but actually going through the process was just very different, if that makes sense.
Yes, it is. It can be.
Yeah. And then also the fact that you're a senior community health worker. And that is something that I also have been one of our clients in my consulting work. We are working to trying to advocate for, use of more community health workers in our state, and helping them with kind of some focus groups and landscape analysis to kind of see
and
what
funding,
the
Dr. Huntley. We need funding.
That part.
They need funding.
Woo. That's like a whole special topic, niche focus. I mean, that all by itself.
Absolutely.
So the fact that you're just the combination of those two is, it's a very unique superpower there. My question, right, I guess we're going to talk a little bit more of that, but before we dive into too much of like where you are right now, let's go back in time a bit. I like to roll back a little bit and to get the full journey and kind of get a sense of where you started. So at what point did you first learn about public health or think about public health as a career?
I was really looking for a new role. I had been working at the shelters that the city set up during COVID. And so I worked with the homeless population for a long time. And I remember just thinking, I saw like another job posting, and I decided to just take a chance. It was a lot of what I was already doing, but wasn't getting paid for, advocating for the needs of others and doing like a lot of community work and learning more about public health, epidemiology, things like that. Well, when you work in any aspect of public, like working with homeless population is public health. All of that it falls under the same umbrella. So I said, well, since I'm already doing this, I just took a chance and decided to go ahead and apply for a position where of a community health worker, but also the distinct differences in working in end of life. And I had never experienced that part. I think it was definitely different. When I thought of a community health worker, I'm thinking, oh, I'm out in the community talking to people. I'm out in SF, but that's what I already like to do. So it's not like this would be different, but end of life is a whole nother different, ball game.
Yeah. I like that you recognize that, well, I'm already doing this. So part of what I'm doing, not getting paid for it, but this is very much public health in the work, and almost like an aha moment, light bulb moment for you. How was the transition for you into hospice work?
It was a challenge. So I came into the program as an apprentice. So That's a learn and earn model. So I was in school getting the certification for community health workers, like taking the classes. Epidemiology was one of the classes, and health and medicine. So me and my other two coworkers, we were in school, but also learning in the field at the same time. So the learning part came with the school, but then it was also built into my workday. And the other part of it was learning how to do community presentations when working with different populations. So I would tailor my presentations to make sure that the content looked like me, the demographic that I was serving, and to just learn more about cultural competency and how to really effectively communicate with certain community members was another part of it.
Mm. Needed. So needed. I think I'm listening thinking that needs to be a part of I think it needs to be a part of every health curriculum anytime you're going to be engaging or dealing with people. But I think it's great that you had that.
Yeah, and starting off with community talks, but not just that, like it's tabling at different events. It's building like solid community partnerships. It's like community health work can be, wide because you're a frontline public health worker to improve health outcomes. So that's a broad role. And that's when I started meeting community health workers from different fields and different hospitals they were specialized in cancer. These were behavioral health. These were, so it was unique that I was working at end of life. That was CHWs that work in end of life. That was a different field, but also, disclaimer, also very difficult too. It's not easy to do that because when you're out there and you meet people, you hear all kinds of stories of, and you have to know how to navigate that.
What are some of the challenges maybe that you encountered, especially with serving communities largely, Latin and Black community? And we're talking about end of life. I know community health workers, because they are frontline public health, I know that there's more of a connection with community. There's a trust. It's easier to connect in the trust with the community health worker is a unique type of special bond. But were there some challenges that stand out to you when you're trying to go into community and you're focused on end of life?
So the one challenge is that who wants to sit around and talk about that for like an hour? Why do I want to do this? So you have to make the curriculum attractive, but you also have to involve community members, meaning asking for feedback from audience members, allowing them to share out if necessary. But you also find a lot of community members who are grateful for the information, grateful that somebody is talking, about it. And we know we need to do this. We just haven't. And we paid for this with mom, dad. We knew we were supposed to. So you get a mixture of both. But is it easy? No. I said, especially since I am not bilingual, any advanced directives that I would give out, we made sure that they were in Spanish and that the marketing materials, especially if I was in an area that was Latinx, making sure all of the marketing materials that I had were in Spanish. Also utilizing one of my coworkers who is Spanish speaking to come and also, help with translation and things like that. But really, as you meet community members, you have a lot of them, that some are resistant, some not. But as I've said, as a CHW, it's not my responsibility to change your mind. It's not my responsibility to tell you what to do. It's just my responsibility is to give you information so that you can make an informed decision, whatever works for you and your family.
Yeah. Yeah. That's good. Well, I probably said it several times throughout this conversation, but I really do appreciate the work in the area, the specific area that you're serving in. I really do. Tell me a bit more about where you are now and more specifically about the work that you're doing now and the organization. Just kind of let's dive into that a little bit.
So where I am right now is, we're in conference season. So we're traveling to Atlanta next week to do a presentation with my coworker at the Community Health Workers Southeast Network. But as a whole, our team is six community health workers that cover the state. And the plan is to grow. But we are currently now offering dementia caregiver support groups. And they, for caregivers who may be at home, who aren't able to, but do still need the additional support. For myself, I have tabled at quite a few events, giving away materials about our community presentations that we offer. I have done quite a few presentations on caregiving, and those, any community talks, those get real, real deep. You have to learn how to navigate those conversations and really how to tailor the conversation, because they can get really, really deep when people are sharing what they're going through. But the other part is I've gotten a lot of positive feedback about planning for end of life, like making sure, like people who come who take all of my 5 wishes documents, they just take them all and just run with them. But people who have done that have given feedback that they were glad that the information was there, present, and available to them. And letting people know that there is a difference between hospice and palliative. I know you see the words together, but there is a difference. So palliative care is at the beginning of a diagnosis. Say I'm diagnosed with stage 4 breast cancer. I'm not dying at the moment, but I do qualify for palliative care. So I can't ask for it. Palliative care is comfort care, meaning you're working with a whole team. They're managing your medication, your pain levels, things like that. But people see that and assume that I'm dying. No, hospice means 6 months or less. There is nothing more medically that the doctors and the teams can do for you. So at that point, that's when you're transitioning into, the end of life final stages. But palliative care and hospice are totally different.
So do most organizations that have hospice in the name also offer palliative care, or they may or may not offer?
They may or may not. I don't think I can speak to that, because I know that I've seen different things. And I just encourage community members to know that you do qualify for palliative care at the beginning of a serious illness diagnosis. Don't assume that the two are not the same. And I've also said that in healthcare, and this is not just healthcare wherever you are, you're your own advocate. You're going to have to learn how to speak up for yourself and demand the best care. Because if you don't have a person to do that for you, say you don't have a caregiver, like you really have to know. And it's okay to ask for a difference of opinion. It's okay to seek a second opinion. It's okay to bring your own research to your doctors, to your teams. All of that's okay, but not to be afraid to do it.
Okay. I liked how you explained the distinction. That was great. And I'm wondering now, I could see how members would say, oh, thank you. This is great information. So your role or your focus is to share the information, make sure they understand it, and then they can decide what they want to do.
Yes, absolutely. But especially when you talk to, I call them my spunky seniors, they're the best. They are the best, I'm telling you. They don't care anyway. They're going to say what they're going to want to say regardless. But, I notice when you approach them a certain kind of way, they're more apt to listen and to really encourage you along. So I love the seniors. Love them.
Yeah. Yeah. I definitely get it. My mother lived in a building with all seniors, and I loved how she always had to give me the update on what's happening around the building, the drama, the mix of personalities. And during the very beginning of the pandemic, people were just genuinely confused. They weren't really understanding all the information that was flying around. And a lot of them were not tech savvy to go online and look up stuff. So I took them as a special area of, and really my family members have to make sure they understand, especially around vaccination. So I would include some of my mother's neighbors in the building, and I would go in and talk. So I got a real good dose of the mix of personalities and how to say certain things and approach certain people. But yeah, seniors are a fun group, special group.
And I've told, other CHWs that come on, they're going to say whatever they want to say. And my famous line is, okay, everybody in this room could probably teach me a thing or two. But right now I'm the teacher. I've had to do that. I said, but all of y'all could probably teach me. So it's like when you come at them a certain kind of way, they're more like, okay, it's different.
Right. Yeah. Yeah. So you, as a senior community health worker, are you still as engaged with the community, or does it feel like more overseeing, or are you supervising maybe the other community health workers?
No. So my role has branched out a little bit to not just community members, but also advocacy and research. I travel to DC a few times a year to talk to state and House leaders about different issues around hospice and also around community health worker initiatives. So I've been with the National Association of Community Health Workers. We went last March, I believe, to Capitol Hill, and I spoke to Senate and House leaders and their staffers. I went again talking about hospice issues. And then after that, but I've been on the Hill before because, like I said, I was doing advocacy work in general because I did it for ovarian cancer. My mother passed. So I started going to DC to talk about public health and other issues around ovarian cancers, especially, the disparities part, making sure women have access to health care and making sure Medicare, Medicaid, do their part, all of that. So I've done it before in another team. So this was kind of like really up my alley. And it was really, really, I had like a light bulb moment this year when I had gone to DC and I realized I'm sitting on panels now teaching new advocates what to expect on the Hill. And I remember sitting as a beginning, not knowing what to expect. And now I'm telling people what to, so I'm like, so I've come a long way. And then now I'm leading research projects, learning community engaged research. I'm a fan of community engaged research because I believe the community should have a stakeholder in whatever it is that you call yourself studying. And you cannot approach us anyway saying you're going to study what? You got to be real clear. You have to be real clear. So, because I believe that when you do a community engaged research project, then the project needs to be filtered back out into the community to see the results, but also to higher ups who need to know and understand this is what your community members need and want from you. So, and don't get me wrong, Dr. Huntley, I like regular research too. I like being slapped on a board somewhere. Hey, you've been published, but I do like research that's more impactful. I'm not a person that likes to just do it just to be doing it because I feel like there's enough of that. So, yeah. And there have been many articles that have come out about how community health workers are leading research about like our role in research, things like that. So yeah, that's kind of where my role has expanded to.
Nice. I'm going to come back to a bit as you were talking about advocacy and that your experience in that role. I'm going to ask a question that is just kind of coming up. I think it's timely given our new presidential administration that's going to be changing over and everyone's really you're concerned about what that means for public health, for health. What would you say in terms of advocacy? So should we be stepping up more? Or, I know some people may feel like, I just don't feel like fighting anymore. Am I going to be heard? Or why am I going to do anymore? And others are just, we have to step up even more. Just in general, if whatever, like for you, it's community health workers and end of life. Insert whatever the topic is for other people and professionals. In general, for advocacy, when there is more opposition that we're speaking to, is it sometimes we should shrink back, lean in more? Like, what are your thoughts on that?
Okay, so I have a lot of the thoughts, Dr. Huntley, but my first thought was when the results came back, I was just like, I don't want to be bothered. Like it was very heartbreaking, but also not very surprising about where we are, I guess, as a country. And I guess, when the board met talking about the National Association, I'm on the policy board. And when we met, I had to be very frank when I said that wherever there's blue or who the relationships that we have kept with our House and Senate leaders, we need to make sure those relationships are still cultivated and that we continue with the work that we've done to make sure that still stays on the floor. With Washington looking the way that it's looking, I'm not even sure if that's even possible anymore at this point. Do I think that we should continue? Yes, because we've come a long way in making sure that community health workers are respected, paid, fair wages. There's still a lot of work on that. And then making sure that we still have a seat at the table. So to know that there's an administration that's coming in that could possibly eliminate all of that, I can't just say that it was an easy conversation or even something that. Do I think we should fight harder? I'm going to say yes and no. I feel like we did fight and that we're continuing to still fight, but I don't have much hope that we're actually going to be seen the same way, because the way the public health system seems to be going, that's really going to affect minority communities. I mean, let's just let's just call a spade a spade. It's gonna affect a lot of minority communities. Does that mean that we give up? No, but it is going to change a lot of how we do things.
Mm-hmm. Do you think that and I'm asking the questions that I think are in some people's minds, but I know that, like I said, I had that one client and we're wrapping up a project and it's really trying to promote the use of community health workers in a broader context than what they are in this particular state. So do you think that for leaders who are saying, and we hear this phrase all the time, really kind of highlighting the importance of these bipartisan relationships and bipartisan communication. Do you think that that's kind of an open door? Like, should we call them out on that? Make good use of that to go to those people that are specifically saying that this is what they want?
Yes, but again, I'm not sure how that would work overall. The fight has to continue. There has to be some type of pushback, just for public health in general. And so many programs that are beneficial to our community are on the verge of trying to be eliminated completely. And that's just really, really heartbreaking. And I don't know. That's why I encouraged our team to, whatever relationship you have with whoever's currently in office, I'm not talking about before January, to make sure that you touch base, that you make sure that our issues are still on the table. I don't know if the bipartisan, I don't know, Dr. Huntley. I don't have much hope for that.
Yeah. So
I don't have it.
That's why I asked, because I think there's a camp that says, that's like a waste of energy because they're just saying that because they feel like they need to say that. It's not going to matter. And then there's others that are like, okay, well, that's an open door. I'm going to go all in there anyway. I'm going to give this a shot. And maybe some of the seeds I plant will fall on a little bit of good ground in there. And maybe even if they're not sincere about the offer or the claim of bipartisan, but I'd be in there in the conversation. Maybe there's something that'll be said or something that will be shared that'll be maybe a little bit of a turn. So we've got this hopeful optimistics that are going to go in there and try anyway. And then we've got these tired folks that are just like, I don't know if I have the energy to go in there and even try that.
Right.
So it's like a question that has no magic answer, right?
A combination of both, really.
Mm-hmm.
That little sliver of hope is always there.
Right.
Maybe we should revolt like some of these other countries. Nope, I'm starting stuff. But yeah, but it's disheartening to know that we've come so far as a workforce to see that all just be at the risk of just being completely eliminated is kind of, that's heartbreaking. But I am hopeful that there are some leaders that are still, willing to fight for the public health system and for minority communities and for initiatives that affect us.
Yeah. I personally would like to see us bond together as a public health industry workforce, and we're definitely stronger together. And those that are normally very vocal and outspoken are just tired, and maybe it's time for some of the rest of us to
step up.
Yeah. And
Dr. Murray said that. She said, "I'm old. I need to retire. Y'all got to step up." She's right.
She's right. Yeah. So, all right. So thank you for allowing me to kind of go down there, but I don't want to even call it a tangent because this is where we are. At the time that we're recording this, it's the end of 2024, but by the time this episode comes out to the podcast as everyone's listening, it'll be right, at this kind of transition, closing out one presidential administration and the new administration kind of coming in and starting to take over. So this is a very timely discussion and things that are already in the minds of our public health folks and a center of a lot of conversations that are happening. So thank you for sharing your view on that as someone who's, been very actively involved in advocacy. I'm enjoying this conversation, and I realize, we probably need to start wrapping this up because we could keep talking on and on, but we want to make this, we want to be cognizant of time. So I'm going to kind of fast forward a little bit and ask you one more question, and then we'll just kind of wrap up. Of course, I'll share your LinkedIn link so people that are listening and want to connect with you, I'll share that in the show notes and so forth. But just thinking about someone who is listening and interested in similar type of work as what you're doing, maybe it's directly with community health workers in some way, or maybe advocating for community health workers, or just supporting community health workers in some aspect, or actually even becoming a community health worker. But is there any, in general, type of advice that you would have for someone who's listening, maybe interested in community health worker in some aspect?
Well, first thing is that you have to be a community people person. If you are not that person, this is not the field for you. It's just not. You have to deal with the public a lot. And that can be very, very challenging. It's not. But if you are a community person and you are interested in improving public health outcomes, and you're someone that enjoys the events, you're a person that loves one-on-one touch points with people, then this is something that would be lucrative for you. But if you're not, it won't be. Because some days I'm even like that. Do I really have to go talk to people today? Not really trying to do that. Yeah. But it's just part of it's just part of the job and what you have to do. But also the main focus for being a CHW is that you're a grassroots person. Grassroots people get really down and dirty with learning about what community needs are. I learned that you change things two ways. You have to change policy, so that policy could be trickled back down to affect community members. So you create change on the ground level and at the national level, making lawmakers do their jobs. Because a lot of them be confused. Do their jobs. This is important. This is what I need. And then encouraging community members to really speak out more and say what they need and not be afraid to do that. Is there a disconnect? Yes, but as a CHW, that's where you come in. So you really have to be someone that likes grassroots work, and someone that really will push initiatives and improving social determinants of health, all of that, because community health workers don't just talk to people. In hospital settings, you help with medication management. You could possibly do home visits. You work on IDT teams, and you help update notes and different things like that. And, and if you're like me, you talk to community members about public health outcomes or things like that. It just depends on where you were looking to be a community health worker and what setting. There are community health workers that are just cancer focused. There are some that are, because I'm on the state commission for gynecological cancers. And one of my other colleagues, she trains community health workers, and that's improving public health outcomes, changing policy. That's something that you need to do. We love to do work here, but we also need to change policy so that it will really go forward. So if you're a person that wants to do that, then this is a good area for you.
Yeah. I like that. I appreciate that frankness. And we don't need any more people going into an area that they're really not.
Yeah. This
blindly walking into realizing. Yes.
Like, I know that I'm somebody that can never go into sales because I'm not about to convince you to buy anything. That's not for me. See, Dr. Huntley, it's not for me. It's not for me.
Yes, that's very good. Well said. Thank you so much. Kandis, I've enjoyed our conversation. I appreciate your frank and honest and open responses and advice and guidance. And I absolutely appreciate the work you're doing from a personal perspective, but I think that also from the industry level, you're doing tremendously important work in a niche that I actually had not thought about community health worker and end of life until our conversation. And I think the more I think about it, the more we need more.
Yes.
We just need more.
This area, you'll learn about death doulas. That is a thing.
I recently learned about death doulas.
That is a thing. So yeah, you start learning about a lot of different things, but I'm grateful for the opportunities that have come my way, the different connections that have been made, the networking opportunities. I've really been blessed in the sense that I've really been able to not just touch lives, but also cultivate really, really strong personal relationships. So
yeah. Well, I appreciate you. So thank you so much for being here.
Thank you.
Well, I hope you enjoyed that conversation as much as Kandis and I did. She is absolutely having a big positive impact on communities she serves. And I encourage you to connect with her and learn more about her work. You can find links to connect with her on the show notes page for this episode, which is episode 387. Simply go to phecpodcast.com, and once you're there, navigate to episode 387 to find the show notes. One more thing before we go. Please take a moment and share this episode with a friend. I'm sure you know someone who would be interested in hearing this conversation, especially someone who has an interest in community health workers. If so, then please share it with them. If you're listening now in one of the podcast apps, you can easily share this episode through a text message or share it directly to social media. At the bottom of the show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.